Now we are going to perform the lumbar rotation techniques in flex position. Patient is on sideline. We move the patient into flexion, and to move the cranial vertebra, I adjust my thumb, the distal spinous process, lateral side of the distal spinous process, and lateral upward side of the superior spinous process. I stabilize the pelvis, and through shoulder I rotate the lumbar vertebrae in flexion. I can also move the caudal vertebra with the help of hip rotation.